Well, today I just want to talk to you a little bit about our garments that we use for patients following liposuction to the chest for gynecomastia. And I just want to explain to you a little bit about the developments that have taken place recently. Like all services, we're constantly trying and striving to improve what we offer our patients in that it's effective and yet sort of comfortable for its intended purposes. And the garments are pretty much a staple, a regular staple for all our patients who've had the surgery, that they have to wear the garment for a couple of weeks after the surgery. Now, these are effectively compression garments. They're made of lycra, stretchy lycra, and the whole purpose of them is to apply a nice even pressure over the operated area, which is the chest. And we want to do this in order to minimize the swelling and make the patient feel a little bit more comfortable. At the same time, it also helps the skin recontour back into the position that we want it to stay and ultimately sit. Now, over the years, we've had various issues with some garments because, understandably, everybody's got a different size and shape to them. So all of these are very good and very conforming to each individual. There are limitations, and so we're constantly trying to understand where we have particular issues, where perhaps the fit isn't quite as good as it can be. So we're constantly looking to evolve it. And recently we've evolved our garment more by having adjustable shoulder straps, as you can see here, with little metal hooks which we can adjust to the appropriate length depending on the build and the height of the individual. In addition to that, we're also making it a little bit more comfortable around the armpit area, where typically we found that the garment was digging in and not being very comfortable. The other areas, we may increase the length of it, because traditionally these garments are only down to about here, which we found out that they tended to dig into the individual and cause a little formation of a line or a crease here. So we've got them a little bit lower down, and that's a lot more comfortable for the patient. So this is the latest evolution, if you like, of our garment, and we're quite pleased with that. But that's not to say, of course, that everything stops there. We're constantly monitoring them and looking at them, and if necessary, if need be, we might develop them again. But we thought we'd just make this little video just to let you know, how we're getting on with that and how we're constantly trying to improve the service and the offering that we have.